John Doe's back was killing him. He tried to keep up with his customary 5-mile run that morning, but just couldn't do it. He was bummed out and fed up. "I'm only 35," he said to himself, "and I haven't done anything except moving those boxes last night. Why am I feeling like a 90-year-old man? There has to be something else going on." He did some research online and discovered that his symptoms lined up with those of a herniated disc. It was time to go have an MRI of his back. He knew he needed a referral for that study, so he made an appointment to see his primary care doctor the next day. John showed up at Dr. Smith's office, iPad in hand, primed with research, everything from the Mayo Clinic to his community message board, ready to share the next steps with Dr. Smith. After an examination, his physician must quickly determine which of many possible diagnostic imaging exams is the most appropriate for the patient's condition. She accesses her practice's Clinical Decision Support, or CDS, tool, inputs the patient information, and marks the indications. Within seconds, the guidelines indicate that no MR exam is required, and the appropriate treatment for this patient is an NSAID, or non-steroidal anti-inflammatory drug. Initially, John continues to advocate for an MRI of the low back, but he and his doctor sit together and review the results of ACR Select and choosing wisely, including discussing the evidence supporting NSAID treatments as opposed to an MRI. Together, they decide that no MRI is needed at this point, and that John should begin NSAIDs and undergo physical therapy instead. Because the CDS tool was integrated into the doctor's EHR, she clicks the recommended treatment plan, and the EHR is updated with decision support data in the patient's record. A few weeks later, John is feeling better. No more back pain, no unnecessary imaging, and no bill.